Okay, hi guys. Good afternoon, everyone. And to those that just woke up, I would say good morning to you, because today is a very chilly Sunday. So it started raining since 6 a.m. lah around here. So today we are gonna talk about suicide prevention and awareness. And joining us today is our everyday beautiful, everyday friendly psychologist, Evelyn Soong from MPS. Yay!
Hi everyone.
Welcome, Evelyn.
Good morning, good
Oh.
evening, good afternoon. Hope you guys are having a good Sunday so far.
Yes, yeah, today actually, yeah, it's quite chilly. I overslept actually. I just had my breakfast like since 11. Okay,
Nice
so other than Evelyn, let's also welcome
Sunday so far.
our the Order of Darkness Before Dawn and also the founder of MHAS, Li Xiaofeng.
Hello
Yeah, it's
everyone,
over
good
there.
afternoon.
Okay, and today I am your host for today. I'm Zhang Ning, and also I'm also co-founder of MHAS. All right, so before we start, if anyone will have any questions, you can post your questions in the Facebook comments. And for anyone that want to stay anonymous while posting question, you can use this link which I'm sending now. Okay, I'm sending on a Facebook comments. All right. So I repeat again, if anyone wants to stay anonymous but still want to ask question, you can click this link to Slido and you can post anonymously. Okay, so before we begin
Any
our session,
question?
let me, sorry?
Any question, guys? Just feel free to shoot away. Don't be shy, because I think this sharing session that you guys MHA organize, I think it's a really great initiative for us to really start having all these difficult but yet necessary kind of conversations. So if you guys have any questions to ask at all, feel free to ask and shoot away.
Yes, and yeah, because today's session is about suicide. It's because actually 10th of September is World Suicide Prevention Awareness Day. So yeah, so today we are talking about suicide. A little bit a brief introduction to suicide statistics. So according to WHO, which is World Health Organization, there are over 800,000 people die due to suicide every year. And that also means one person died in every 40 seconds due to suicide. So it's pretty high. For example, it's like every less than 1 minute as one person die. And also that what's more, suicide is the second leading cause of death in teens aged between 15 to 29 years old. And there are also indications that for each adult who died of suicide, there may be more than 20 others are attempting suicide. Means every 800,000 people that managed to die, or what we call it, managed to suicide successfully suicide, there are 20 more people that are attempting it, which they did not succeed in suicide. So the numbers is very scary lah. It's very high, which is 16 million people are attempting suicide each year. So yeah, just some facts as well, which is there's also 75% of suicide occur in low and middle income countries, and mental disorders, harmful use of alcohol contribute to many suicides around the world. So, and early identification and effective management are key to ensuring people receive the care they need. So, all these are taken from WHO, the World Health Organization. So, yeah, the first question is I would like to ask our friendly psychologist here, which is for it's very weird because when you think about it, why people suicide? Because isn't it very weird for someone who wants to kill himself or herself? Because according to biology, every living things are striving to live, but somehow human will have this tendency to kill himself or herself. Yeah, why people suicide?
Mm. Right. So this is a very good question. So a lot of people, they ask, so what is actually going through their minds, right? Why they actually decided to end their lives and things like that. So I'll use an analogy to help everyone to understand what is actually going on, right? So for some of you may have, gone for long walks or marathon, and especially for ladies, right? If you buy new flats, sometimes at the beginning when you start using it, you get blisters at the back of your feet, right? You guys have that experience before. And for guys, sometimes shoes that are uncomfortable, you get blisters every now and then. And when you have these blisters, a lot of times, you just say like, I just want to sit down and rest, like, because it's so painful, right? Even though you know that, you need to, let's say, complete your marathon or you need to walk to your car, but sometimes it's just too painful until you just wish to take out your shoes and just walk barefooted. Or in certain situations in marathon, right, where you're just so tired to even run and you just wish that, okay, I'll just give up, take the ambulance to go to the ending point, right? So sounds familiar for some of you. So it's almost the same. So imagine this journey of marathon is just like journey in life, right? And it's the fact that, these shoes, uncomfortable shoes, or the uphill that you're running, these are like the circumstances that the person is experiencing. So be it like work stress or be it family problems, right? The blisters, try to imagine the blisters, it's like the pain that you're going through. So blister itself is like a physical pain, like a scarring thing. But try to imagine this pain is similar to the emotional pain that someone may be experiencing. So a lot of times, even according to research, people who, decide to end their lives or thought about ending their lives, it's not really that they want to end their life, but they want to end all this emotional pain. It's just similar like how, we say, okay, I'm not going to finish the run, I'm going to call quits. It's something similar to that. So at that point, a lot of people, if they're going through such despair, they feel like they want to give up again. It is because of the emotional pain. The way they think at that point, maybe they feel like, I don't want to be burdensome to other people, and exit or ending my life could possibly be the only option. But at the same time, they're also feeling extremely vulnerable and helpless too. But I believe, by getting the right support, by getting the necessary help, these people can actually complete this journey and not necessarily ending their life. So that is what we're talking about today, about prevention as well.
So, Flynn, who is the highest risk of suicide in Malaysia? Is it a student or working adults or adolescents?
Right. So according to this research by YouGov in 2019, generally, like a quarter of Malaysians do have suicidal thoughts. So 1 in every 4 Malaysians, they do express suicidal thoughts. So when we look into the population, majority of these who express suicidal thoughts are young adults. So age 18 to 24, according to their research, right? And the older adults, they do express, but much lesser. So young adults, about 32%. Older adults, age 55 and above, it's about 9% or something like that. But in, let's say, generally, so we know Malaysia, young adults are the ones. But if, let's say, we compare to, people who are at risk, right? In Asia, statistically, we do show greater risk in the sense that we do have easier access to, let's say, lethal means, for example, pesticides. So these factors combined together can actually increase the risk for suicide in general.
I see. Then, Evelyn, based on your many years of exposure in the psychology field, is it often for you to encounter people who are mentally ill, has been thinking of suicide? Is it common?
So actually, we always feel that, people who decide to end their lives, they are mentally ill. But research shown otherwise. People who are not, so to speak, mentally ill, so healthy samples, do think about suicide too. And not all individuals with some psychology disorder are suicidal. So it goes both ways, right? Some of the mental health disorders, for example, like say depression or schizophrenia or bipolar, they may have higher chances or higher risk to think about suicide or attempt suicide, complete suicide. But then again, many of us, I believe here listening, including myself, sometimes, we just feel, I just want to just end it all, but it may not necessarily mean that I would like to end my life. So suicidal thoughts itself, it's pretty much, in the sense that everyone would think about. But the act itself may not necessarily mean individuals who has a mental health disorder or not will not think will think about that. So basically what I'm trying to say is individuals with mental health problems, right? Not all they would think about suicide. But individuals without a mental health disorder, it doesn't mean that they will not think about suicide too. So it's actually both ways.
But can we consider all people who are diagnosed with mental illness like depression, bipolar, the risk of committing suicide?
Yes. So to answer your question, Xiaofeng, it does increase the risk, but it doesn't equate to the fact that they will commit suicide, right? So just for an example, right, if say I sprain my leg once, it will increase the possibility of me spraining my leg again, right? But it doesn't mean that I sprain my leg once, then the next time if I go for a run, I'll definitely 100% sprain my leg. So it does, what I'm trying to say is it may increase the risk, it does increase the risk, but then we also need to take into consideration other things because a lot of times mental health or mental disorders, it is a combination of different factors. We need to consider, the circumstances that this person is going through, the social support, and also the type of mental disorders.
So I suppose if people with mental illness get proper treatment, they will reduce the risk of committing suicide.
I would say that through, let's say, therapy or through medication, it can help to reduce the possible risk. But then again, when we talk about suicide, it is also a tricky thing, right? Even though sometimes, people around and families, the psychiatrists, the psychologists can be doing the right thing, right? But there isn't, like, say, 100% prevention in a sense, but we can definitely reduce the risk together.
Okay, so what Evelyn said just now is that people with mental illness have the tendency or the probability of wanting to suicide, but also people outside of mental illness also have the tendency of attempting suicide. Is that correct? So it's
Yes.
a correlation. There's a correlation between mental illness and suicide, lah, but not 100% causation, because people that have mental illness, not 100% will want to commit suicide, like that, lah. So it's got correlation but not causation.
So I would say suicide, when we talk about suicide, we can split into a couple of things, right? So suicidal thoughts, right? Suicidal ideation, meaning to say, like say, sometimes I think about, just end it all, ending my life, but not to the point where ideation, meaning to say, let's say I planned on how to, commit suicide, that suicidal ideation. We have suicidal attempts, means the action itself, and then complete suicide. So there are different forms when we talk about suicide. So in generally, I mean, suicidal thoughts is really very common, right? Again, individuals who doesn't have a mental health illnesses or disorder can also express suicidal thoughts. But when we talk about suicidal ideation and attempt, it would be slightly different. So if you talk about whether it's correlation or not, I would say certain mental health illnesses, like we shared about earlier, do actually have an association with attempting suicide or complete suicide, such as depression, schizophrenia, bipolar, or even substance use, right? It does increase the risk of it. But then again, all these things, mental illnesses, even though it's one of the factor, we must also consider other factors when it comes to attempts and also ideation or even complete suicide. So perhaps a lot of them do have many other triggers as well, such as, feelings of, defeated, helpless, which makes them don't feel like living anymore. So again, suicide itself, there are different kind of areas that we look into, even when it comes to defining suicide itself.
We have a question here.
Hmm.
How to educate family members of a patient with history of multiple parasite suicidal attempt?
Right. How to educate family members of a patient with history of multiple parasuicidal attempt. Right. So a lot of times as family members, right? So first of all, thank you for your question, Hafiz. As family members, I believe it is extremely difficult because it's someone that we care for and we really want to help them, to support them, right? And when it comes to educating, a lot of clients that I've come across with also, parents or family members, out of their really good intention, they just want to protect their child or their family member. They say things, for instance, suicide is against the law, suicide is against the religion. Why are you so, why are you not trying your best enough to cope? Maybe you could try exercising, maybe you could do something about it, right? With their very good intention, they're really just trying to help this particular family member, maybe feeling really, really helpless. Now, when it comes to educating, based on my experience, this way of education may work to some extent, but the people, a family member, or a patient with history of parasuicidal attempt may feel really turned off, or maybe they may feel like not supported, right? So there are a couple of things that we can actually do on how can we approach this particular individual before even trying to seek help. I would say education would go to a point, but also seeking help would also be extremely important as well. So how do we support this person to seek help while trying to educate them, trying to normalize things? I think that's very important, which we would be covering for our session in a bit as well. So educating, supporting, and also, trying to normalize that, I would say, to begin with.
Okay, thank you, Hafiz, for your question. So our next question. So what should we do if someone tells us they are thinking about suicide? People might think that they are seeking for attention and just like, this is a joke.
Yeah. So this is related to the question that you have, Hafiz. So yes, a lot of people may feel that, whether this person is seeking for attention or they just want other people's pity and things like that, right? So whether this person is really seeking for attention or that person really does feel suicidal, I don't think it's our role to judge in that sense, because try to imagine, right, the fact that if a person needs to go all out to seek attention by saying that they want to die, try to imagine how they actually feel. Perhaps this person is really feeling very lonely, actually, that no one actually understands. That's why this person needs to go to that extent to seek some form of attention even. So our role as family member, as the friend, it's not to judge them whether it's real or not, but we should take it seriously as well, because we never know what will happen, right? So we should still take it seriously. And what can we actually do? So there's actually two parts that I would like to share with everyone here. The first part is this acronym called the A, P, and R. APR basically means A stands for ask, P stands for persuade, R would stand for refer, right? At the end of the session, by the way, we'll be sending out some handouts, okay? And this APR is also in there, so you guys can refer to. So ask basically mean that, to support this person, to even ask this person, asking them whether they are thinking about suicide. Sometimes people around may even, they cut themselves and they may not say it, right? Parasuicide, or even sometimes they may express things like, this world is not worth living anymore, and I just wish that I could sleep and not wake up, right? So ask this person, start by asking, hey, I'm getting really concerned about you, and there's just something that I'm just wondering, when you share about all these things that you don't feel like waking up anymore, has suicide ever crossed your mind? So ask this person whether they are feeling suicidal. Now, I know some of you may be thinking about, whether this question will plant this idea in their head and whether or not they will really go and attempt suicide, right? Now, according to research, again, statistically, asking the suicide question will not plant this idea in their head, but in fact, it can actually make them feel relief and allowing them to share what they are going through. Because the fact that you took this courage to ask the question, and then they would feel, in a way, safe enough to express themselves. So the first thing is ask. The second part is to persuade. Now, how do you persuade a person that, you really understand them and you really want them to seek help and to get support? A lot of times for that person to be able to feel persuaded, right? It's just like how a person wants to be listened to or understood. You will tend to get persuaded by a person when you feel that person understand you, right? If the person didn't understand you, you are less likely to be able to get persuaded by them. So try to use all your skills, right? The skills that we're referring here is by listening to this person, making the person feel, accepted or understood. And generally what we're trying to achieve here is basically for that person to feel like, hey, this person really understands me and I can share all these things together with this person, right? So basically persuade, make this person feel understood, accepted, and actually telling them that it's okay to seek for help. And the last part here would be refer. R stands for refer. So basically seeking help together with this person, trying to find out more information together with this person, whether it's seeing a psychologist or a psychiatrist, what's the process like. So this would be the first bit that I say: ask, persuade, and refer.
Okay.
Yay, I'm back.
Welcome back.
Sorry, my internet
We missed
wasn't.
you for a while.
Yeah. my internet connection wasn't stable, so I hit the router a few times and it works fine now. Okay. So yeah, where were we just now?
So we are at so what should we do if someone tells us about suicide? So I'm not sure what is your experience like from the audience. How is your experience like when it comes to people? If anyone has shared with you that they're feeling suicidal, how do you respond, or how do you feel actually? Because it can feel very helpless. I'm not sure if Xiaofeng and Janine, you guys have that experience before, like friends or family expressing that to you.
Uh, Back when I was in secondary school it's like, it's not like they are serious. Like I want to die lah. So many homework. They always joke something like that. So yeah, for me, I think these kind of things uh kind of hard to tell, because sometimes, because we always joke around using this, like, hey, so many homework, ayo, later teacher need to check my homework, I didn't do homework, I will feel like dying now, or something related to stress. They will say, I just want to end it all, I just want to die, please don't
Yeah.
wake me up, something like that. So for serious one, like attempting I never encountered before, but for jokingly saying one, there are a lot of people are joking about this. So
Yeah.
yeah, that's from my experience.
Yeah. Yeah.
I'm just curious. Just now Janine said they are joking, but is it they are expressing their emotion and they really want to attempt?
Uh, that's why it's hard to judge. For
Yeah.
somehow until now, none of my friends attempted lah. So luckily, they are just joking.
Mm,
Yeah.
right. You
But I
notice
do
like,
know, yeah. But
sorry,
I
go
do know
ahead.
some people really like they memang joke lah. They appear jokingly, but maybe later on they will try it. So I'm not saying that when people joke you can take it lightly, but still it's still better to take precautions. Even people are joking about this because some people, as we know, they even though they are smiling, but inside they are still hurting. Yeah,
Yeah,
like that.
very well. And you know, like how Malaysians will say, "Ayo, die la, die la, die la," right? But then again, I like how you say it like that,
Yeah.
Xiaofeng, like whether or not this person, really feel strongly about suicide and whether or not they are just saying it jokingly, right? So a lot of people would then ask about warning signs, what kind of stuff and things like that. So yeah, I think how do we differentiate? I think that's a very good topic that
Yeah, yeah, yeah.
we're.
Well, how do we differentiate? Because when you mentioned about this, because
Mm.
I think there any telltale signs that we can look for in someone that has a tendency to commit suicide.
Right. So generally, if a person who feels strongly, having suicidal ideation beyond thoughts, just suicidal ideation where they, would plan it out and attempt. Generally, there are a couple of areas to look into. So I'll split this into two areas now. Okay. The first one will be the verbal part, verbal cues. So they would express not just for that one time or during that exam period about feeling suicidal, but they may express it a couple of times. It can be direct or indirect. Sometimes people will say that, "Ayo, I just feel I want to die," right? But some people can may also express it indirectly. For example, saying like, "I wish I will just sleep and not wake up forever." Those are the direct and indirect. So through verbal cues, or even they will say indirectly, life is so tired and they feel trapped or feel like they are a burden to other people. So from their narratives, from their verbal cues, you can kind of gauge consistently about how this person is actually coping. So part one will be through verbal cues. Part two will be through behavioral cues. So for example, you may observe them feeling more withdrawn at work with their friends, or they may have changes in their appetite, like they're eating lesser or suddenly they eat a lot more. Some people, their sleep is also affected, whether sleeping less or sleeping more, or even increase in alcohol use, substance use. Right. So these are some of the behavioral cues that you can take note of. And for some people, their mood, there are also some cues when it comes to mood that can be observed through their behavior. So for example, they're constantly agitated, low energy, irritated, or their mood tend to fluctuate a lot. So you can kind of tell like, hey, this person doesn't feel like how she used to be in the past, and especially this past 1 to 2 weeks. So maybe this will be really the best time to check in with this person and see how he or she is doing, because you never know. And sometimes just by asking itself be really can really relieve that kind of burden experience that that person who is suffering is experiencing. Yeah. So those are
Mm,
the cues, verbal and behavior cues.
see, so it's not like most of the cases like they are not just saying once or twice, but a lot of times they keep mentioning. Then that's the cue you should take notice. Yeah. See.
Yeah. So consistently saying it, and then there are also some behavioral cues that you notice. You just feel like this person recently a bit weird lah. We always say like, this person recently a bit weird. Don't know why suddenly like angry only. Don't know why suddenly like feel very irritated. And you may feel even angry or irritated. But if you really stop and really observe and listen to this person, then check in with him or her. There's no harm to check in with him or her on this. So start by asking.
We have the question from Hafiz.
Mm.
Do patients with tendency of self-harm, example cutting, are high risk of suicide?
Right. Thanks for your question, Hafiz. So patient with self-harm will in fact increase the risk of suicide, right? But then when we look into self-harm, right, even in Malaysia, about 20 to 30% of young adults do have experience of self-harm, such as cutting. Now, self-harm can mean many different things for different people. The most commonly that I've heard from my clients is that they feel like self-harm by cutting, for instance, tend to relieve that kind of pain that they are experiencing. Like they're actually channeling all this out. So they actually feel more relief, right? But when we look from the biological perspective, individuals who cut, for instance, right? Let's say right now I accidentally cut myself, or I self-harm, I cut myself here. These scars, your body will tend to react by generating some, let's say, natural painkiller to reduce the pain here, right? But this natural painkiller that your body produces will actually kind of soothe the emotional pain that you're experiencing as well. So that is why some people tend to cut themselves and they tend to feel better after that. That's because your body generates that natural painkillers that helps with your emotional pain on top of the physical pain too, right? But if you say whether it will increase the risk of suicide, I think that it would increase the risk. So it's always good to check in with this person, whether this person is trying to get attention or it's actually a sign to call for help. So our role here is not to judge them, but to support them in whichever way we can and to bring them to seek the necessary treatment or intervention that they need.
Okay, thank you, Hafiz, for your question.
Thank you. So any one of you guys have any question, feel free to ask. We really hope that this session will be a good sharing session for everyone here who's tuned in.
So our next question is actually what's the most common reason that cause people attempt suicide? I think pressure is the main reason.
So the most common reasons, so there are actually many different reasons. So I'll split this to two parts that we can see from bigger picture and then in Malaysia itself, right? So when we compare the West and Asian, in the West, research shows that 90% of the time, people commit or attempt suicide is because of certain mental illness, right? And in Asia country, less than 65% is because of mental illness, but it takes into consideration of many other social cultural factors. So it's interesting in this study, they compare the West and the Asian, them attempting suicide, right? So the West, 90% is mental illness. Asian, majority is because of this social cultural issue. So when they compare, right? So women who divorce, right? The chances of women or men divorcing, becoming a divorcee, suicide rate is actually higher among the Asian as compared to the Western. So this goes to show that, like Asian country, we are this whole collectivist kind from that perspective. where we value a lot about, how people see us, this face value about shame, guilt, do not bring shame to the family. All these kind of factors tend to have an influence for higher kind of risk factor for people to attempt suicide. But say in Malaysia, right, what I'm seeing is that those who attempt suicide for adults, for say children, and then the elderly is also a bit different. So for adults, especially during these unprecedented times, employment would be one, right? Going through grief and loss, substance abuse, violence, or even like what I shared earlier about lethal means, little access to lethal means would also increase the risk for suicide, one of the common reasons. For children and adolescents, what I'm hearing based on the clients that I'm seeing is also issues related to family, related to school, bullying. And for the elderly, most of the time it's, feeling that they don't want to burden their family members, want to burden the society. These are some of the factors that would increase the risk as well.
So can suicide caused by only one single factor?
Mm.
For example, I being laid off or being pay cuts during the MCO.
So I would say suicide is actually an accumulation of many, many different things. So it's just like, again, use the example of the sprained leg. Will a new shoe increase the possibility of you spraining your leg again? The answer will be no, right? New shoe, maybe if you're not used to it, maybe the road condition, maybe some parts of your muscles are, weak. Maybe there are many other thousands of possibilities, right? Same goes to suicide as well. There are many reasons that lead to a person having suicidal thoughts or attempting suicide. But one thing that, like when we talk about accumulation, so imagine things are being accumulated. So one small trigger, let's say just a normal argument with family, can have like a total different reaction because this person may be holding on for it for so long. Just one small trigger itself can actually lead to a person attempting suicide. But a lot of us may think that it's that small trigger that has caused it, right? But not necessarily. It is actually an accumulation of many different things.
So as Evelyn you said, it's accumulate reason. So I suppose someone's suicide can be predictable. Means we can predict someone's have a behavior or something change if they attempt suicide.
Right. So there are some warning signs, right? Like the verbal and behavioral cues that we can take note of, that we could possibly predict in that sense or take note of. There are also some situations where suicide happen as an impulsive kind of act. So, for example, if let's say today suddenly I had an argument with my better half, right? Argument with my spouse, and that argument it just makes me feel so defeated, so demotivated, just feel like life is not worth living, and then I just ended my life like that. That could happen as well. But most of the time, they are verbal, there are behavioral cues, and if we take notice of all these things, these are something that could possibly prevent a person from attempting suicide. So there are things that we can do, guys.
Yeah. So suicide is preventable.
Suicide is in a way preventable, but then again, I wouldn't say it's 100% kind of prevention, right? It's just like, again, using an example, I sound like a broken record with the sprained leg example, but you can go for, do all your warm-ups, you can have the best shoe, you can train very well, but that doesn't 100% prevent you from spraining your knee. So same thing, there are things that we can do well. Perhaps, you've listened to this person really well, you've supported this person really well, but then the actual fact, if this person still choose to attempt suicide, right? There are really, this is not your failure. I want you to know that this is not your failure, but this is just really the limitation when it comes to supporting someone who may be going through a tough time. And we are all human too. And as much as we want to be there to support this person, but do know that there are limitations that what we can do, even as a mental health professional, right? Can't be there 24/7 for our clients, but know that you are responsible for your action at that time to support your friend, my clients, you're there. But then you can't take this full responsibility on what's going to happen. So you're responsible for your own action and not others.
See, okay. So, apart from what you mentioned just now, like you can talk to them or you can give them more extra care for someone that you think might suicide. What else can we do to like further prevent this suicide from happening? How
Right.
can we help them if we identify them?
Right. So actually, we talked about the APR earlier, right? Ask, persuade, and refer. And how can we actually, persuade this person if, let's say, the person is not hearing? So what can we do extra? Now, I'd like to introduce you this to the second part that I shared earlier. It's called the LEAP, LEAP. L stands for listen. E stands for empathize. A stands for accept. P stands for partner. Okay. So basically, even before this person is willing to go seek help, right? You need this person to be able to trust you enough. Because without this person trusting you, whatever you try to drag this person to go seek services, maybe this person will be really mad and angry, right? So how do you first start at the very beginning? How do you connect with this person and to make this person feel like you are supporting them and you are on their side? So through LEAP. So first thing, L, listen. Listen to understand and listen not to jump into conclusion. So for instance, if a person tells you that, I feel like I just really cannot, I just want to end it all. It's very tempting or, feeling that we just want to tell this person, no, don't think like that. This is wrong to think like that. You have so many things ahead of you, right? We try to give hope to this person. But are we actually listening what this person is saying? Why is this person feeling suicidal? So ask this person, be curious and ask this person where they are coming from by saying, not to say like, why you think you want to suicide? Things not good, man. Right? That is also not really listening, right? Because it feels so cold, so mean, right? But listen to really, by asking them, I hear that you must be struggling quite a lot for you to say that. I'm wondering what is going through in your head, what's going through in your mind right now or recently. So try to connect with this person, even though this person may say things that you disagree about, but that's your worldview, right? That's how you see it, not how that person is seeing it. So listening, trying to understand doesn't necessarily mean that you're accepting what the person is saying, but we're basically listening without giving any judgment, right? So that's the first part. The second part is empathize. And empathize, this can be quite difficult to do because it basically means try to feel how is it like being in his or her shoe and try to make this person know that you understand how it feels to be in that shoe. Basically wanting this person to say, yes, that is exactly how I feel and that's exactly how I mean, right? You want this person to agree with you that you understand. So even though, there may be times like, let's say I am feeling really helpless because recently I have so much work to do and I just don't feel like doing. I just want to end everything. I don't want people to come and kacau me anymore, right? If an empathetic response would be, just by saying, must have been going through so much, of all these deadlines. You're trying to cope with all these deadlines, but you just feel that you can't, and it's draining you off. So basically, trying to say what the client said earlier. We are not parroting what the person is saying, but we're trying to try to understand and express whether you are understanding this person correctly or not. If you are, then you were able to empathize with this particular individual. The third part would be agree. Agree means finding a point of agreement with them. So, if let's say a person tells you right now that with the whole MCO, with me losing my job right now, it is so difficult to get a job, and how do I pay my bills? I think I should just go kill myself because I really can't take on all this stress anymore. Rather than saying, yeah, it's okay lah, good things will come, right? How do we empathize with this person and make the person know that we understand? Perhaps we can say things like, yeah, it is true. Such times during MCO, it is really, really difficult to get a job, stable income. So you can actually agree to the first bit of what the person say. The last part the person says about ending their life, you can actually not say that out. But basically trying to make that person feel like, you agree, you understand what they're experiencing. So that's the third part, agree. The last part here would be partnering. Partnering basically means that try to partner with this person and try to tell this person that, hey, I'm here to support you. Let's see what are the other options that are available. I can even accompany you to see a mental health professional if you want to. I can accompany you to seek for services. But if let's say they are hesitant, they don't want, and you're still worried about them, you can really tell them things like, hey, I think I'm really concerned about you, and seeing you go through all these things is really very difficult. And I believe it's even more difficult for you. And I think you deserve to feel better. You deserve to seek all this help and treatment. Know that you're not alone in this. So LEAP, listen, empathize, agree, and partner. Then we can fall back to what we talked about earlier about ask, persuade, and refer. So these two things.
Wow, I see. So yeah, it's quite easy to remember, right? Leap. So think of people about to suicide are trying to, leap from tall building. And then yeah, it's quite easy. I like this acronym. It's quite easy to
It's
memorize.
easy to remember. When it comes to executing, it can be really, really difficult, right? I will not lie, even as a mental health professional, sometimes to go like listen, empathize, agree, and partner, it can be very challenging as well. So it really takes a lot of effort, practice, and then practice.
But I think the most important part is the L part, which is listening, because I think that's the first thing we can do, and it's also the easiest. I think it's the easiest. Is it the easiest thing we can do for anyone, which is just to borrow our ears and listen to their 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 stories, or their hardships.
Don't feel
So
pressure
yeah.
to say anything, guys, when you're listening to this person, right? Because sometimes, the stories that they tell you, you may even feel like, oh man, I would feel exactly how you're feeling if I'm in your shoes. Don't feel pressure to say anything if you can't think about anything. Sometimes I would say to my clients like, wow, that's a lot, and I really don't know what to say, but know that I am really listening. And a lot of times, perhaps that's really what they need. And that will give you some time to process your own thoughts and to try to come out on what to say. But if you really don't have anything to say, you can't seem to find the word, that's fine. That's fine too. Just be there for them.
I see. Okay, so so this is the part where we can help other people. So, Evelyn, what if the one that are looking for help is us? Like, what happen if we happen to be the one that was feeling has the tendency to commit suicide? What can we do to prevent this ourselves?
Mm. So your question is, what if we ourselves feeling suicidal? Is that what you mean?
Mm,
Okay.
yes.
So now that you realize that there are some warning signs, cues, and if you notice that you're actually going through this yourself, do not wait. It's okay to give yourself the permission to reach out and to speak to other people. There are so many different channels that are available. There are hospitals that are available. There are health facilities. There are also, if you guys have heard of Mentari, Mentari is actually an initiative by the Ministry of Health Malaysia to reach out to individuals with mental health problems. So they actually have different of these health facilities set up to assist individuals with mental health problems. So you can look out for Mentari. You can also look out for mental health professional, credible mental health professional, be it psychiatrist, clinical psychologist, or counselor, or even NGO. So there are a list of different kind of support that is available out there, which it will be in the brochure that we will be passing later on. So yeah, give your permission to reach out for help. Know that it is okay to reach out for help.
See. Okay. So what if we saw someone like it's too late? The person is impulsive. He or she is about to commit it, and what we are there watching, and then in this case, what can we do to help? Like,
Mm,
he's impulsive, she's impulsive. There's nothing. Everything I said, they won't listen. What can we do?
right. So if you know that this person is at a really high risk to attempt suicide, first thing that you need to do is to make sure that whatever that they are going to use, the means that they have, it's away from them, right? But if let's say they want to jump off from the building, the first thing that you need to do is to call the police, call 999, call the police, and then tell them your location, tell them what is happening. If you happen to know their family members' number, call their family members or next of kin, inform them about this. Because the first priority is also to keep this person safe. So do call the
Mm.
police authorities, call family members.
Oh yeah, speaking about calling the authorities, right?
Mm,
Because I heard that in Malaysia, right, people who attempting to suicide will get fined because based on there's a news it's from the Star. It says court fines man 3,000 ringgit for attempting suicide. So I want to ask, why is it the government or our law is fining people for trying to suicide?
yeah, this is something that really gets to my nerve, right? So um, suicide is seen as a crime in Malaysia in the penal code. And so, just a little bit of the background, right? Why is suicide a crime in Malaysia?
Mm,
So, our penal code is actually an antique law inherited from the British colonizer, and we
mm,
have never changed since then. So why do they criminalize suicide back then? Because it actually has like a big influence from the religion perspective, where they say that only the creator can destroy or take away someone else's life. Back then, this law was also to maintain social order. So basically, they are trying to avoid people from escaping being punished for the crime that they've committed, right? But one thing is,
mm,
even in England, the European country, they have all decriminalized suicide already. But we're still holding this because we have not actually changed since then, right? So it's actually when a person is being fined, like the news that you've read from the
mhm,
Star, I think that's just cruel in my point of view, because that person has to end his or her life, to end the pain, goes to show that they're actually going through a lot emotionally, right? They're going through a lot of stresses and things like that. But on top of that, instead of giving the support and the help that they need, they actually find this person, right? So try to imagine, I mean, just thinking, right? I can't will definitely not be able to fully understand what he is going through, but I'll imagine he would feel even more depressed and helpless, because I want to end my life because my life just is falling apart, and right now I'm being treated like a crime, right? So that
Yeah.
adds on to even, I mean, extra stress. What were your guys' reaction when you guys read the news? I mean, I was really pissed. I was really angry. What was your reaction,
Yeah.
guys?
Yeah, let us know, guys. What do you think about this penal code that fine people for attempting suicide? In my opinion, yeah, it's like what Evelyn says. People that trying to suicide or planning to suicide actually has underwent a lot of pain, and I think by doing this, by finding them is actually add-ons to their stress. Also, they will feel more bad for their emotional. So I don't know. What I can think is the worst case is people who attempted suicide and they didn't manage to die in the end. They still alive, but still paralyzed, or maybe they are disabled for their whole life, but still getting on top of that, still getting this 3,000 ringgit penalty. It's like, wow, it's like they are more depressed, or their life is more sucky like that. So
Exactly.
yeah. Oh yeah, so another thing not much related to suicide, but I heard from my friends.
Mm-hmm.
So there's some phenomenon called the call of void, which is another term for that is called high place phenomena, which is
Mm.
actually an urge to jump from tall places
Yes.
when the person is maybe standing on top of skyscrapers, or maybe is living in a very high rise apartment. So they
Mm.
have this tendency to jump when they are looking outside. So should they? So these kind of people, because I know it's not uncommon, it's quite common. It's not
Yeah.
they are trying to end their life, but it's the urge to jump. So for this kind of person, should they consult with a psychiatric or
Mm.
to seek for help?
Right. That's a great question. I'm glad you brought this out, Ning. So yes, the high place phenomenon is actually the scientific term, and you guys can actually Google that up to look up for journals. HPP, high place phenomenon, or the call of the void. It's the urge of a person wanting to jump off of a building. So I actually did some readings on this, right? And what is interesting is, before answering your question,
Mhm.
learning, they compare two groups. So a group A, they are a group of individuals who have, let's say, some mental health condition, depression, bipolar, and things like that. So group A. Group two, it's individuals without a mental health condition, right? Has never thought about suicide before. So group one has thought of suicide with mental health condition, group two without. So when they do this comparison and ask about this HPT, right? So what was interesting was that 80% of this group with mental health condition shared that, this feeling is quite familiar of their urge of wanting to jump, similar to how they are feeling as in, when they're suicidal, when they're standing at the tall building. The second group, without a mental health problem, guess what? 45% of them has this thought that came into their head about jumping, but they have never experienced suicidal thoughts before in their lives. So what this research shows is that, this is a very interesting phenomena, because basically what happened at that time when a person is standing there, this urge to jump, it's actually like a misinterpretation of the safety and survival signal that is built in us, right? So basically, when we have that thought, we will also have the counter thought by the thought that says, you need to be careful, don't lean so near, step away, that kind of thing. So basically, it's a misinterpretation of our survival and safety kind of signal. But generally, people who are more anxious in nature, they tend to have this kind of feeling more as compared to individuals who are not anxious. I'm saying anxious as in like feeling anxious in general, not necessarily anxiety disorder per se. So they tend to have higher tendency of having that kind of feeling. So having that thought doesn't mean that this person is suicidal. It basically it's your body kind of safety and survival signal that got, a bit luan, a bit misinterpreted there. But if let's say you have this thought, this urge, and you really want to do it to end your life, that is when you should take a pause, speak to someone, reach out to a mental health professional.
I think suicide is preventable. So yeah, this it's a helpline for best friend befriender and helpline lifeline association Malaysia. So if you need the emotional support, you can call them. So I think this comes to the end of our session. Thank you, Evelyn. I think you have answered all the questions with lots of insight and knowledge. Hopefully we have another session with you soon. Thank you.
Thank you so much for having me, guys. But remember, for you guys out there, supporting your family members or friends, who are going through a tough time, you guys are a soldier. Know that you're not alone in this. Know that you can try your very best to help them. But meanwhile, please, please also take care of yourself. Don't forget and neglect yourself, guys. Thank you so much for having me today.
All right. Thank you,
Thank you,
Evelyn.
everyone.
And thank you, Xiaofeng, for joining us.
Everyone.
So that's all for today. And we'll see you next time on the next topic.
All right. Thank you, everyone. Bye bye.
Thank you. Bye.